Well, I think Perfecto is best to describe by its acronym. It's Perfecto. It's Perfecto. And I'll explain you very briefly in 5 bullet points why Perfecto is Perfecto. The first point, Perfecto, is about understanding. And one of the questions at the beginning put by MEP Jerkovic was what prevention means. And usually we discuss, and today we've discussed a lot about biomedical aspects, about genetics. This is very important, of course, about different models to implement screening in different health systems. This is very important. But if you look from the perspective of the health determinants, this is only 25% of our health. 70%, it's about individual behavior, social factors, and environmental factors. And Perfecto is looking to FH pediatric screening through the lens of these neglected health determinants, in particular social and individual behavioral factors. And what we did in Perfecto so far was to use different methods and tools from social sciences to take the advantages of generative AI and to build a personalized communication model. In other words, we analyze very complex social data, health system related data, quantitative and qualitative data, and we have been able to identify in Romania, but as well in Cyprus, different clusters at population level, and for each of the clusters, different personas. So in other words, we know if we like to implement a communication, an education or literacy campaign in one of our countries and probably others, we know how to go really in a very personalized way. And we are actually using the same approach in FH early through the involvement protocol, who is actually the basis for what Fausto mentioned earlier, the EPP, expert patient panel. The second the attribute of Perfecto is implementation. It's not just a very nice theoretical exercise recognized by the European Association for Preventative Cardiology, but it's about implementation. Currently in Cyprus and Romania running campaigns, and in Romania we are actually implementing a campaign at the national level. So we are looking to the macro level of the situation, and then we started to work with a group, very well-defined group of people, 60 persons, meso level, considering who are the influencers, who are the organization, who influence their choices, their preferences, and so on. And we started to identify people at high risk for cardiovascular diseases and to work with them at a very micro level. So 3 layers of implementation. The third point is very much linked to what I already said. It's about equity. And of course, I'm biased because I live in Romania, but this project actually is implemented in Romania, in Cyprus. Our colleagues from Bulgaria are involved in some activities in Perfecto. So what I'm trying to say is with this project, we are really building a model to address the East-West divide on one side, but as well because we implement this in rural settings. In Romania, in small towns, we can address the rural-urban dimension, inequities, and so on. So this is the third. The fourth is about synergies. So nobody, European Commission or HADEA, they don't ask us when starting Perfecto to do synergies other than the synergies with Jakarta. But, you know, people we've met in communities, they ask us to do something for their cardiovascular health. And this is how you mentioned, Madalena, for PCAM project. This is a project focusing on cancer primary prevention. This is how we actually started to organize joint activities between the 2 projects in Lereș Living Lab. It's an increasingly famous living lab dealing with NCD prevention overall. And in this living lab, what we did in June this year was to calculate, to test, first of all, 200 persons from Romania for the lipid panels plus LP(a), and we calculated for them for the first time in a structured way in Romania the global cardiovascular risk, as Professor Cronenberg mentioned earlier today. And we are now in a position to see that we have access not only to medical data, some genetics data, but a lot of behavioral and social sciences data from this panel of individuals. And this integration was not done before. So this is a power of combining and creating synergies between the two projects, starting by listening to people, the real people. You go in a community, meet person, simply listen to them, and then they will guide you what to do. And the fifth point, the keyword is commitment. And you cannot find on cardiovascular health a group who is more commitment to the cardiovascular health, to CVD prevention than the PERFECTO group. PERFECTO is co-funded by the European Commission. And PERFECTO consists of 6 organizations, not-for-profits and academia, who committed to allocate 40% of the PERFECTO budget for 2.5 years from our pockets. And I think this is an argument to look from this commitment perspective and to understand why and how this topic becomes so important for us. And my last comment is, of course, with PERFECTO and FHLE, we are on the path of having an impact. And from a business and probably competitiveness perspective, I think it makes absolutely sense to continue to invest in success. So from the next European Cardiovascular Health Plan perspective and future calls, I know that there are some restrictions, but we cannot afford to lose the momentum and the achievements and the investments done by now, both by the European Commission and this small organization, but with a big impact.